Welcome to those joining. We'll get started in just a couple minutes. Stephen, any calls from Andrew Cuomo these days?
No, I think Andrew's got a lot of other things to deal with. He has not asked me to come on by. No.
It looks like the Caribbean and LATAM are the new epicenters.
You know, it is their winter, right? So the Southern Hemisphere is definitely going to be challenged and may give us some idea of what to expect in the fall, but we will see.
It's a little bit frightening. I think at this point, we're just going to take everything day by day.
I think so. I mean, hopefully we've caught up with respect to PPE. Hopefully, we're working on a lot of therapies. Vaccines are on the fast track. So we need to get back to work, and then we'll need to see how things go.
Alrighty, I think we're gonna go ahead. It's 2 after, so we'll go ahead and get started. All right, thank you everybody as you are tuning in to our COVID-19 Frontline series with Dr. Stephen Howe. Before we get started on our topic today, we do want to just take a moment to acknowledge the pain that our country is going through today and the challenges that our brothers and sisters in the Black community are facing with the tragedies of George Floyd, Mr. Arbery and Ms. Taylor, and countless others who we don't even know about. We recognize that not all voices in our alumni community have been given an equal platform. So we as the MIT Club of Northern California and also the MIT Catalyst podcast, we welcome your feedback for the types of conversations that you believe our community needs to be having. And we are all ears and listening and learning. But before we got started, we did just want to acknowledge the challenges that our country is going through today in the midst of a pandemic. Like, we needed another challenge to already go through. Having said that, we want to welcome a very special guest today that we featured on episode 9 of the MIT Catalyst podcast, Dr. Stephen Howe. Thank you for being here today. To do a short intro, so Dr. Stephen Howe is the president of Sutter West Bay Medical Group and medical director of the Bay Area Cardiovascular Service Line. He directs the electrophysiology program at CPMC, California Pacific Medical Center. He graduated from MIT in 1992 and got his MD from the University of Pennsylvania in 1996. He did his postdoctoral training, an internship and residency in internal medicine at New York Presbyterian Hospital, plus 2 fellowships in cardiology and cardiac electrophysiology at Cornell University. He is a member of the American College of Cardiology, the American Medical Association, and the Heart Rhythm Society. Thank you for being with us here today.
Thank you for having me. It's a pleasure.
I asked you this question last time we spoke, and I'm going to ask it again. How is the morale today in your practice and even your personal morale as we are all adjusting to this new normal?
I think that on the medical community side, particularly here in Northern California, I think we are encouraged by the results of everyone's sacrifice. people have sheltered at home. People, unfortunately, have lost their jobs. They've done the right thing by doing social distancing. And we have seen a remarkable, particularly here in San Francisco, remarkable bending of the curve, where we still have COVID positive patients coming to the hospital, but really low numbers relative to peer cities across the country, and unfortunately also relatively low to cities across the world. And so here in Northern California, we've done the right thing. And it's really interesting, and we'll learn a lot when we look backwards. The fact that we did our social distancing early has really made a big impact. So I would say the morale overall is that we're encouraged and we're ready to sort of take the next step in sort of trying to maintain now the coverage, but also we need to take care of other patients with other diseases, who have been sort of holding back on care, or too afraid to go to the hospital, or too afraid to go see the physicians. And we know that COVID-19 did not cure all the other diseases. And so we need to get back to work, just as everyone else is trying to get back to work. So I think overall the morale is good, and we're very encouraged. I think there is, though, cautious optimism for the rest of the year, because we do recognize that this disease is not gone. And so, I think that all in all, we're encouraged, we're optimistic, but we're also realistic in the way that we need to continue to manage this pandemic.
Great, cautious optimism. What is the new normal like, at least here in Northern California, and as a cardiologist today? And the second part of my question is, how are you convincing patients who do need care and who do need to come in now to feel safe to come back?
Right. So, I think that I'll take the second part of the question, and I'll have you ask the first again. So really about safety. And what's been really remarkable and seen across the world is that there's been a remarkable decrease in people showing up with heart attacks and strokes to the emergency rooms. And a lot of that is due to fear, because like I said, we do not believe that COVID-19 cured all these diseases. And unfortunately, people are suffering at home, or suffering events, or unfortunately dying at home when they could have come to the emergency rooms to be treated. And this is definitely something that we're working very hard to let people know that they really should not be waiting, and they really should be coming to medical attention so that we can do appropriate care. Because heart attacks, unfortunately, once the tissue is dead, we won't be able to bring it back. Same thing with strokes. And these are just two examples. There are obviously multiple other diseases that really can have significant impacts if you don't have timely care. And so what we're doing is a couple things. Number one is when we bring patients to the hospital, and with testing has really have improved, we test everyone who comes to the hospital. We limit the number of visitors, or have been restricting visitors that come to the hospital, so that hospitals actually are safe and clean places to have care right now. There's also extensive screening of patients who come to the office. And so that, again, we can appropriately segregate patients who are potentially what we call persons of interest with respect to the COVID pandemic, put them in the right place, and be able to treat them and diagnose them if it's respected to the pandemic and COVID, or have it be a clean and safe area if they're not. The other thing that we've done is we've remarkably ramped up video visits. And so we can still see patients and generally take care of patients. Obviously, there are limitations. We can't do a physical exam. We don't understand what their heart rhythm looks like, but we can continue to sort of move forward care. And so I think all in all, really one is education of the patients, that we have taken the steps to be able to sort of bring you to the office or to the hospital safely. Secondarily, if you delay care, you may be actually hurting yourself long term. And then the third is really leveraging virtual visits right now, so that people can be seen by a physician or a clinician and then really directed towards the right avenue of care, whether it be, again, medical therapy on the outpatient side, or say, look, you really do need to go to the hospital. Let's tell you how to get to the hospital safely. Let's tell you how to get the care that you need. And so I think all in all, a lot of it is education. A lot of that will be, we're sending out emails, there are phone calls, there's advertisements, there are just direct reach outs from the physicians to the patients to make sure they understand that, it is safe and it's appropriate to present for care.
That's great. So it sounds like you're in a process of rebuilding or building that trust to get patients to feel comfortable and to recognize when they do need to come in and how they can do so safely.
Absolutely. And I think that's really important. And everyone needs to understand that. And we don't want to delay care. We don't want to put people, in risky situations, unnecessarily, but definitely we're finding a lot of people, unfortunately, are waiting too long, and we really need to get that message out.
Great, that makes sense. So going back to the first part of my question, what is a new normal like as a doctor and as a cardiologist?
So, I would say, within our medical group and within sort of our health system in Northern California, really the new normal is not that much different than before. I mean, I would say the difference I would say is, number one, everyone's getting their temperature checked coming in and out of any facility. Number two, there is also testing that's required for physicians and caretakers to make sure that there is no infection or occult infection. Number three, we've all entered a compact, within our health system or medical group or hospital, such that if you are sick, you are not coming to work. And so, there was always that slippery slope where people just felt like they needed to deal with this illness and show up to work. And so I think there is that understanding that it's not only just for you, but it's really also you're taking care of your community, taking care of your coworkers, taking care of the people that you work with. We're all wearing masks in the hospital. We're all wearing masks in the office. And a lot of that, again, is about protecting our coworkers, protecting our patients. And so the new normal is just an enhanced awareness that it's not just about you, or it's not just about you and your individual patient, but it's about what you can do to protect your community. And so we have to take those steps. Sometimes that is a sacrifice if you have to be quarantined or isolated if you're exposed. And it's necessary for us to move forward. And I think that is a paradigm that as we open up, everyone sort of needs to understand that is part of the deal, and I have young kids, a daughter just graduated from college, another one in high school. And there is a lot of understanding and work trying to get these kids back to school and understanding of what it means to be back to school. And there will likely need to be that kind of compact in that type of situation as well. I think above and beyond that there is a change, as I mentioned, in virtual visits to be able to see patients and deal with them effectively and continue to communicate sort of in these types of realms. But overall, other than that, the medicine's the same. Treating COVID, obviously, COVID positive patients, requires some ICU skills and respiratory therapies. And then, there are a lot of other complications that can occur. But other than that, sort of medicine and work goes on.
I see. And since we last spoke, I guess I'm curious, I want to revisit some of the topics we touched on last time, such as, I know PPE was a big topic. Have you seen improvement there? And do you feel like you have the equipment and safety that you need in order to do your job?
Yeah. So PPE, particularly at the beginning of the pandemic, was a major issue. And we spoke about this. And the reason it was a major issue is that everyone in the world was dealing with the same issue at the same time. And generally what will happen is everyone is competing for similar equipment. And that was the major issue. And I believe that overall the supply chains have caught up. And so there's been a lot of work done to acquire enough PPE. And I think the supplies have overall caught up to a certain extent. And this, to be honest, was part of the plan when you talk to public health agencies about sort of taking a hospital that was essentially shut down and waiting for COVID positive patients. In our case, really the surge was minimal. But to open up the hospital to more routine care, you need to have a certain amount of PPE on hand so that if there was any blip in any of the curves and people were showing up, we would be able to take care of them and treat them safely. So PPE continues to always be a concern, and we used to have daily calls, now a couple times a week calls to make sure that our PAR levels are where they need to be, but overall we have caught up. And so we can, I think overall people feel fairly, at least here in Northern California, feel very safe and very well protected with the amount of PPE that we have, and particularly at the Sutter hospitals that I work in.
That's great. I'm glad to hear that. Any surprises so far? I know we're a few months into this, and what are you most apprehensive about? What is top of mind for you? Is it the second wave, or is it something else?
You know, I think there is that. I think there was. I have to say, and I'll get to your question in a second. One of the things that we talked about was very heartening and heartfelt, heartwarming, I guess would be the right way to say this, was that the whole global community from a medical and scientific standpoint really pulled together. And we pulled together, and there was a remarkable pace with respect to communication and people really trying to sort of advance care, bringing drugs into studies, and trying to really understand what was going on and what therapies actually make a difference. What's also very heartening is that there are a number of vaccines that are in the market and moving forward actually at a very brisk pace. However, there also comes the other side of doing things very quickly. And number one, I would say is trying to run studies properly. And so that we really, from a scientific standpoint, can really define what works and what doesn't work. And I think that is part of the difficulty, particularly early on when we don't know and we haven't had the ability to really study things well, but we really have to work quickly because unfortunately people are sick and people were dying. In China, they were throwing the kitchen sink at everyone. We tried to be a little bit better and learn from China's experience and from Europe's experience. But unfortunately, sometimes what people find and the information that's coming out in the medical side, as well as out in the lay press, sometimes this drug worked on one day and then all of a sudden a study comes out and says it doesn't work, or someone said that potentially this will work and this won't. And so I would say that what continues to be difficult for us is to really deal with the noise of people sort of jumping on one bandwagon versus another, as well as making sure that we can run the trials properly, get the studies done, and move forward. I'm encouraged by all the vaccines, and particularly the phase 1 studies have shown that patients can develop neutralizing antibodies, and they were able to determine some dosage because that's really important, and some very early information about safety. But really, they're pushing hard to move from phase 1 quickly, sometimes even jumping over phase 2 to phase 3 studies and very large studies to see if these vaccines are going to be and trying to get them available as soon as possible. However, we are concerned about, number one, making sure that it will be effective in preventing disease. And then number two, obviously the safety profile is also really important. And usually what takes years, we're doing in months. And so I think there is, like I said, cautious optimism, but we have to be careful about doing it the right way. And part of the strengths here, particularly in the United States, is the FDA process. But we are really throwing out the book and pushing things through quickly. And my hope is that we will still be able to sort of do things safely and do things well. And so I would say that is one thing that I think that's troubling to a lot of people is that we sort of hear about drugs like hydroxychloroquine, that it may work and everyone's super excited, but then some subsequent studies say, oh, it actually didn't work. And then the study that said it didn't work had to be retracted because the data set that wasn't verifiable or robust enough. And so people are pushing information out as quickly as possible, but then we have to go back and sometimes pull it back. And that is unfortunately just really a response to how quickly we want to try and get information out to help people who are sick right now. And so that is one thing that I think is a challenge, particularly people in the lay public, as well as us in the medical community, to try and balance what is truly effective and what is truly efficacious, unfortunately, in a disease that we don't have right now. You know, there are some drugs that have some promise, remdesivir, and then there's one that's primarily out in Russia that has been shown some in particularly moderate disease to hopefully be effective. But again, sometimes they're small studies, sometimes they're not in all populations. And so we're still trying to work through all of that. And I would say that continues to be a challenge.
Right, and it's definitely a trade-off between speed and accuracy, right? And we're trying to move as fast as we can through this. So this is definitely a race to the cure, and hopefully that moves in the right direction.
Right.
What about antibody testing? There's been a lot of antibody testing out there, and some that are completely not accurate. So do you have any perspective on antibody testing and the role that could play in helping the world reopen safely?
Right. So let's talk about testing in general. You know, when you develop tests, we want them very sensitive and very specific. And a lot of it has to do with what's the positive predictive value, what's the negative predictive value of a test. And a lot of that also is very dependent on the prevalence of the disease in the population. And so it's again, it gets down to basic statistics. And this is really important to understand. And so when typically what happened is the FDA would work with a company and verify sensitivity, specificity, and process and quality control of these tests before they would be FDA approved and hit the market. Given the current and aggressive nature of spread, there was a lot of emergency use authorizations of these tests, and FDA is working hard to catch up and to make sure that everything is up to snuff and par. But unfortunately, getting a lot of tests to market, there probably were tests that weren't as sensitive, weren't as accurate, and part of this is the diagnosis, which is a PCR test looking for the specific RNA associated with the virus, and then there's antibody testing. Now, with respect to antibody testing, we have the same issues about sensitivity, specificity, and some of the antibody tests that we were importing weren't as sensitive and specific as they thought or they were advertising them to be, and that's a problem. Some of the tests that have been developed more recently appear to be more sensitive and specific because, again, there are other coronaviruses running around and that we're exposed to. And so you don't want to have a positive antibody test to a coronavirus, but have it be because you were exposed to one, but not COVID-19. And so that is something that requires some work and testing to verify, again, the accuracy of the test. Now, even if we do have an accurate test, and there are some that are purported to be very accurate, Roche is one of them, well, what does it mean? And we believe, we're hopeful that if you do have antibodies, that it will make a difference and prevent future infection. But we're not sure about that. We haven't really verified that in large populations to be confident that would be the case. I think there is definitely some very interesting data to suggest that they would be, because the antibodies are neutralizing and they're developing plasma from patients who have previously been infected as a therapy to help some of the severely ill. So that is a very good sign that, again, if you develop antibodies, it can be protective. But then there's a question, but we don't know that for sure. Then there's a question of how long will it be protective? Because we definitely have shown that our immunity can wane over time. And that's often why we need to get booster shots or other types of vaccines to maintain that immunity over time. And so as we said, there's a lot to still learn. Again, we're optimistic and hopeful that a vaccine will proffer immunity, and that will, again, get us out of the cycle of right now sort of persistent and sort of low grade, at least here in Northern California, and then other places, unfortunately, more robust infection rates and hospitalizations that we're seeing other places in the world. Now, getting back to work, given that we don't know that antibody testing in and of antibodies themselves are protective enough, a lot of public health departments are not hanging their hats on that as the reason for people to get back to work. As we learn more, I think it's something that could be considered. I think that there is a lot of concern about misuse of that kind of information. People intentionally getting infected so they can develop antibodies to go to work. I don't think that that's what we're recommending or what we should encourage. There's also the ability to falsify and not do it properly. So, all in all, it probably will be, and we're hopeful that antibodies do make a difference. If we have a really accurate test and it's available, I think we potentially should start using that to really understand the true extent of the disease. But it's still early in the game. We need more testing, and we need better understanding of what this will mean.
Right, and I think that there's apprehension, right? Because states are starting to reopen, and some doing so prematurely, and a lot of debate over when is it safe, right? And what advice do you have for us to stay vigilant for this extended period of time and staying resilient? Because we started to see that people are getting restless, and some are just, they're coming out and they want to get their old lives back.
Yeah. Well, I think there's a couple things, and maybe this is, I don't think there's many times when I wanted to be a public health official or a politician. I'm happy where I am, but these are some tough decisions. People not working, losing their jobs, not being able to have health insurance, not being able to put food on a table, that in and of itself is a public health emergency. People not going and getting medical care in and of itself is hurting a lot of people, and a lot of people are suffering because of that. And so I think there is a balance of getting back to work, understanding, what can we do to sort of live with this until we can get a vaccine. And even if we get a vaccine, we're probably still going to live with this coronavirus. I'm not sure that this coronavirus is going to go away. It may be just one of the things that we see, but at least we'll be manageable. So I think really what it comes down to is, what do we know? Well, we know it's very contagious. We know that it is really droplet borne, and social distancing worked. Wearing of face coverings and masks actually worked. And so that is why we're encouraging the community to continue to work within that paradigm. Trying to minimize a lot of close exposure will continue to help keep the lid is probably maybe not the right term, but sort of keep the infection rate at not a very high level. And so that it's manageable from a healthcare system standpoint. Unfortunately, for the people who are elderly at risk, we really need to prevent them from getting exposed. And so they're going to be very restricted. But if we forego all social distancing, if we forego all masks, it will come back. And I think it's just a matter of time. And so I think really the best we can say is follow social distancing, work with your employers to try and figure out a way to safely get back to work, and then we will move forward from there. We'll get a vaccine soon, so this is not going to be forever. And then we're going to be hopeful that the vaccine will proffer immunity for at least a reasonable period of time. And that will allow us to continue. It will buy us time for us to develop other therapies that will really make a difference.
Great. And I want to bring up in light of current events, there are protests across the nation and crowds of folks who are masked, but they're in close proximity. Any tips for those who are participating in these protests to stay safe? I guess as a medical professional, does it make you nervous? And any words of advice?
Well, look, what has happened to our country is heartbreaking. One was the pandemic, and then the second is the social unrest for, what was a terrible tragedy. And so I think all in all, people were scared, and from the pandemic itself, they're worried about their future because of the economy being shut down. And then you add this on top, it was almost like a match on a powder keg. From a medical standpoint, and definitely support and recognize the need to express and really work towards change, but it is very concerning to see large numbers of people, even though they're wearing masks, shouting and yelling, which we know actually disperses the virus more vigorously. Really, the exposure it's going to be there, and it's going to result in more infection. And so there was a call out for anyone who was in protest to go and get tested, and I think that seems very reasonable. Now, part of the compact really to protect everyone in our community is that if you are positive, you need to quarantine yourself. Again, thankfully, not everyone who's positive will get really sick, but anyone who's positive can definitely spread this. And so I think a lot of it will be, number one, don't go to work and don't exposing a lot of people if you are sick. Number two, get tested if you were exposed to a lot of people in close quarters. And then really, quarantine yourself appropriately if you are positive. And those are the things that I think, just sort of basic recommendations are sort of what will be needed in the short term.
And what about those of us, the research showing asymptomatic spreaders, and how there's a significant portion of people who will never display symptoms? What's the best way to manage that?
And so that's really one of the main reasons why there has been this push for face coverings. So I think it's really important to understand that the face coverings themselves are more to protect everyone else from you than you from everyone else. And so that is to help manage a lot of asymptomatic transmission of the disease. And so again, that's just part of us being a community, protecting each other, is wearing the face coverings and staying and having the social distancing. It's getting tiring. We all know it, and we all feel it. And up to this point in time, it's made a difference. That's sort of what we need to do. And if you do test positive, again, your sacrifice, I guess, for lack of a better term, even though you may not feel ill, your sacrifice to protect everyone else is to sort of isolate yourself and quarantine yourself. And so it's a tough one. It's a tough one to understand. It's a tough one to sometimes swallow, but it really is what's made the difference. And so I would say, again, everyone's working furiously to come up with fancy and significant therapies and vaccines that will make a difference. We're understanding more and more about this virus, how it attacks blood vessels, as well as the alveoli in the lungs, as well as the cardiac myocardium, and it causes blood clots and causes stroke. We're learning all of these things, and we're working to help manage this. We're also really trying to study and understand why some populations do better or worse. Is it the social determinant of disease? Is there some genetic difference that makes one more prone towards severe illness versus other? Because a lot of this has to do with how your immune system deals with the disease. And so we're working very hard and learning, but it's, again, what really has made a difference actually is us staying home and us minimizing exposure, just because of how contagious this disease can be. So that R naught, the number of people that you can affect, was well above 2, we believe, and maybe sometimes close to 3. It's become significantly lower when you do social distancing and wear the face coverings and protect yourselves. And again, we learned that. And so we didn't know it from the very beginning, which is why some of the recommendations have changed over time.
And what else have we learned? You had touched upon, we're starting to tease out some of the comorbidities and some of the correlations to genetics. And I know from the start there's been, obesity, diabetes, and heart issues have been some of the findings. Is there anything else that has come out recently about this?
So it's interesting. So this virus it's an mRNA enveloped, membrane enveloped virus. We believe it binds to this receptor called ACE2. ACE2 is found in the lower respiratory tract. It is found in the myocardium. It's the heart is found in the lining of blood vessels. And we have seen virus tend to congregate in those areas. We've seen cell death in those areas, and it does explain a lot of the disease or the symptoms that people present with, right? Again, ARDS, the respiratory illness, the severe respiratory illness that can occur with this infection is, again, your immune system attacking the virus, but unfortunately also attacking ourselves, attacking the lungs, and the lungs fill up with fluid. We can't oxygenate, people get short of breath, and hence the need for ventilators and long-term care, proning, et cetera. And what we really are doing is supporting the body until the immune system can calm down, get the virus infection under control, and then recover. And the recovery is also, unfortunately, not just leaving the ICU or leaving the hospital. There's a prolonged recovery afterwards. We found that actually a lot of people, some people will develop cardiomyopathies, heart failure, weak heart muscle. Some people will also develop blood clots in arteries and veins, and that can lead to strokes in young people, as well as blood clots that can travel to the lungs and actually worsen respiratory failure. We've also found that inflammation of the lining of blood vessels to other organs can be one of the reasons why people develop multi-organ failure. All of these things are extremely interesting from a scientific standpoint, from a medical standpoint. It can explain a lot of why things are going on. It does what it does, but this will be in the future, is help us consider directed therapy, or what we should consider to do, develop drugs to help treat this disease. So obviously, don't get infected. That's what we're doing right now. If you do get infected, is there something we can do to address the virus so that it spreads less quickly, or we can abbreviate that? And so that's some of the antiviral therapy. But if you do get very ill, what can we do to manage the immune system? What can we do to prevent or protect from end organ damage? So to try and abbreviate the severity of the disease and the course of the disease, so that, again, the body can recover. And so, these are things that we're learning, and I think a lot of people are studying and moving forward. The genetic component and whether, there's been some, the problem I think with some of the genetic and some of the societal sort of views is that the data is very messy. Some data that's coming out of outside of the US may suggest that, again, race may play a big role. Some data that came out of Oceaner down in Louisiana said, well, yes, actually African Americans unfortunately were sicker. And then again, a lot of this has to do with the social determinants of disease and other things. And maybe a higher percentage of them did get hospitalized, but the mortality, when you adjust for some of their comorbidities relative to whites, at least in Louisiana, in the Oceaner Clinic, they didn't die at a higher rate. So it may be not just race, maybe it has to do, again, with your comorbidities. Why do comorbidities increase your risk, not necessarily of catching the disease, but of getting very sick? I think a lot of that also has to do with how much body reserve, whether you were impaired from a cardiac standpoint or immune standpoint previously, then your ability to respond, your ability to compensate for an infection is definitely less than someone who is otherwise healthy. And so this is how it all sort of comes together. And again, we can, from an epidemiologic standpoint, know, wow, if you're older and you have other illnesses, you are unfortunately dying at a much higher rate. We're starting to understand why that it will be the case, and then trying to develop therapies to prevent it.
I see. Yeah, it's been, I feel, like you said, cautiously optimistic that with all of these studies, that we'll have some breakthroughs, and that the next time we connect, there'll be some positive news.
One thing I mentioned before, and it's still the case, what's really heartening, what's really amazing is the whole scientific community across the world working together and sharing the information. We're getting it out in journals as quickly as possible. They're peer reviewing it as best they can. And we're really trying to get at this. And this is the one time when we cannot isolate ourselves. We have to work as a global community, because it serves no one's interest for you not to share information. It serves no one's interest to not work together, to not trust each other. Now, we recognize sometimes there will be some bad actors or people who present things not truthfully or inadvertently not come to the right conclusions. We will stumble along that way, but I think all in all, working together and getting it out will be helpful. The other thing, I mean, we have to give some credit. Our governments are spending lots of money and investing in therapies and vaccines before they're proven. And that's how we can get things quickly to market. And so most of the time you wouldn't start working on mass production of a vaccine until you got through all the studies, which is, again, doing it in a very serial method, phase 1, phase 2, phase 3, approval, and then ramping up. They're now doing a lot of things in parallel, which otherwise they would not have financially taken that risk unless it was supported and currently supported by the government. So there's a lot of parallel processing right now moving forward, particularly on the vaccine front. And so I think, that is, again, very encouraging. We still want to make sure we do it safely. So all in all, working together, investing in parallel processing is really what will make us move forward, will make us more comfortable, will get us to that new normal that we're hoping will happen very soon. But realistically, 2021.
It is a marathon, and I can't imagine what it's like being close to this, and the resilience and the exhaustion that the medical community must be feeling. How has this changed you personally and professionally over just the course of the past few months?
I've always loved what I do. I will tell you that, I think it's really, I guess, reignited a certain extent, a respect for my colleagues. There are particularly, we mentioned before, the nurses that come into work day in and day out are really in the front line. People come to work, people expose themselves, and we're, in some respects, selfless because this is what we do. We're trained to do this. And it's almost very much like going to war, and being sort of that front line infantry person, to go and fight for the community. And that's what we're doing. And so I would say that that's one thing that I've always respected my peers and respected what we can do. This, really sort of takes that and brings it back and brings it up to a higher level. I think that's one thing that's changed. The second, I think it continues to reinforce how, we are just one human race. We're not black, we're not white, we're not Asian, we're not American versus, I mean, we're all together in this. And really, for me, in particular, we all need to work on this, and we all need to continue to work together and invest together. And it's not about one person winning or losing, because we will all lose as one race. And so I think that sort of, professionally, I think is one thing. I would say from a person, I really do cherish, some of the time that I've been able to spend with my family, even though we've been very busy medically and administratively. And I talk to my kids and I talk to my wife, and we have lots to complain about, but we really shouldn't. We are fortunate to live here in Northern California, United States, and still overall do well. So, but I think all in all, putting things in perspective and not losing sight of sort of the long term, continues to sort of be what drives me and what keeps me grounded. I hate that we have to continue to think about race and social unrest with respect to that. That's just unbelievable at this, in what we believe is a very advanced society. But maybe we will make some change. Maybe we will make some difference. But, to add that on top of everything else, people are at work, I recognize too, we need to be able to have people feel secure and safe. So I think all in all, a lot of this makes me appreciate for what I have, the communities I'm involved in, one of which obviously is MIT, and really just hopefully focusing on what's important. Sometimes we tend to lose that focus.
That was very inspirational. Thank you. And I agree with you. I think that now more than ever, we are seeing how interconnected humanity is. And I hope that when we look back and our children and grandchildren ask us, hey, what was 2020 like? That sounded like a crazy year. We're able to talk about the triumph and coming out of the other side and the healing that comes out of this. So that is what we're all hoping for here.
Yeah, I'm hoping we can take a break from one catastrophe from another. We go from a Great Recession to fires to pandemic to riots. After we get this, I would hope for a little bit of a peaceful time, but we will see.
I hope so too. They say bad things happen in threes, and I feel like we got the three. So hopefully this is only upside from here.
I certainly hope so. I mean, there are locusts swarming in Africa right now. It is a trying time. It is a trying time, but I'm hoping for a little bit of peace after we get through this.
Well, to close off here, I just want to ask what parting words you have for us as a community, as lay people, as citizens of this country, and any parting words for us as we're embracing this new normal.
Look, I think that I wish I can say a lot of words of wisdom. The one thing, and I mentioned this before, and I really want to focus. I've really loved going to MIT, and I enjoyed my time there, the people that I met there, and the community. But really, the ability to sort of have all these smart people working together and encouraging and helping each other. And I think that microcosm, and then this sort of larger community here we have in MIT Northern California, um, needs to continue and expand outward. We saw lots of people who are at home helping their neighbors, sometimes going to work and building PPE and being sort of inspired to go out and help. And I think that is really the true strength of our community, but the true strength of our society. And that, really fundamentally, I think all in all, that will hopefully be what continues to drive us to do good and to do better, and to build better lives for ourselves and our children. And so this pandemic really continues to put everything in perspective. But I believe those will still be some of the driving things that we need to work with, and we need to continue to collaborate. We need to sort of do the things that make a difference. And I know this community does that. And I want everyone to sort of continue to work at that. As we mentioned before, we will get through this. It will be trying, but it requires all of us to cooperate and look towards that higher cause. We're all here to protect each other. We're all here to be healthy and move forward. And we will get out on the other side. It will take some time, and then we'll have hopefully close to normal. If not, well, we always talk about that new normal. But I think we will get past this, and I think that's the most important thing to take home. There will be bumps in the road. We may see a second surge, but if we're all working together on this, we will defeat it.
Thank you. Well, thank you so much for being on our webcast today. We really appreciate your time. And again, thank you to the medical community who are working day in and day out to keep us safe.
No, I appreciate that. And really, the medical community appreciates the sacrifices everyone has made. And again, we only will succeed by doing it together. But thank you.
Thank you. And we'll continue wearing our masks.
Right. Wash your hands and,
all right,
and be well.
Thank you.
Okay. Bye-bye.